Okay, everyone, we are live, and just as a reminder, by participating in the meeting, you are giving your consent for the meeting to be recorded. And also, of course, we are live streaming it so that the public can be joining us via our YouTube channel right now. Just a few reminders, housekeeping items. Remember to mute your line if you are not speaking. Make sure before you do speak that you state your name. Every vote that we do does need to be a roll call vote. So Paige, make sure you ask for that each time, please. And again, we are recording and live streaming this right at this moment. So Paige, I will let you go ahead and take it away from here.
Great, it is 3:01. I'd like to call this meeting to order, and can I get a roll call, please?
Paige Toth.
Present.
Candace Clevenger.
Present.
Vivian Goodman.
Present.
Jan Hack. Dr. Jurger. Sue Krause.
Present.
Mary Jane Linton. Dr. Meningati. Dr. Patterson. Phil Tips.
Present.
Laura Zimmerman. That's everyone.
I just joined.
Oh, Mary Jane, thank you.
Yes, I had trouble getting on. Not because of you, because of my end.
Okay, thank you.
All right, up next, Brandy, is there any public comment today?
We do not have anyone present today, and I did not receive any public comment prior to the meeting. And we checked that just a few minutes ago just to make sure nothing came in. I will tell you, although not during public comment, but after I kind of update you on things, I do have Tanya Andrix with Crossing Healthcare on the meeting today that wants to share some information with you as well. So just wanted you to be aware that she's with us today.
Great, thank you. Okay, Brandy, it looks like I'm turning it over to you for new business.
Okay, so you can all see the item on your agenda, and that was posted and that was sent out to you last week for this emergency meeting. Again, I apologize for the late notice, but of course we didn't have a lot of time, and I wanted to make sure you all had as much notice as possible, and then we're also able to get updated before some of the meetings that are coming this week very quickly upon us. So thank you all for joining. I do sincerely appreciate that. I wanted to make you aware, as I had said in the email, that there was something that we found out about that was going on at the county level. We became aware on the 6th, which was Wednesday of last week, excuse me, that something was coming for the health department, and they wanted us to be notified. So we did meet with Kevin Greenfield and Julie Moore-Wolf and Mike Baggett with the state's attorney's office on Thursday, and Kevin Greenfield made us aware that he is going to propose an edit to the Macon County Food Sanitation Ordinance, which would remove all or most of our ability to enforce any COVID-19 regulations that would be specific to indoor dining. So I did send you those two drafts. We were provided those at the meeting on Thursday. And as you can see, they're a little bit different. One pretty much says no enforcement whatsoever with indoor dining, and one says that we can enforce things like capacity and social distancing, but nothing else. What they did make us aware of is that that will not necessarily be final language that will be voted on if it is voted on, but those are the drafts that they have at this point. So you should have received those with the email that I did send out to you. Usually the process with an ordinance, if you've been with us on the board for a while, you're aware, but I want to make sure all of you are aware of that process, is that first we would edit an ordinance such as the food ordinance and work with legal at the state's attorney's office to get that updated, and then would bring it to you as our Board of Health for you to review that and then vote to approve it and move it on to the county committees, and then eventually be voted on by the full county board. Sorry for our speaker system there. And so in this situation, of course, this is not the process that was followed, and this is not an ordinance edit that was brought forth by my team or myself or us as the health department. And at this point, what we have been told is the Macon County Board of Health basically can't do anything as far as stopping this from happening. Or delaying it, nothing like that. Really, at this point, what you can do is provide any feedback that you have, provide any, statements or information that you would like for me to take to these meetings this week. It does say on the agenda that we are able, or that you are able as the board to vote on this if you choose to do that. And that was also language that we received from the state's attorney's office, with this being a little bit different of an agenda than we're used to because it is an emergency meeting. And so the ability for you to vote on something, they did not want to completely remove that. But can you have Sandy called, please, so she can screen him? You already screened him? Okay, you can come in, Kevin.
Thank you very much.
You can just sit in one of those. Hello.
How are you?
Good, thank you. Okay, so trying to remember where I was at now. Okay, so what we can do at this point, the language on the agenda does provide that if you want to vote on something, you can. That is there, so you can take action if you choose to. But we more expected this to be a type of discussion and then to receive any kind of feedback from you that you would like me to take. What my plan after today's meeting is to do is to go to the city council meeting this evening, and then to go to the EEHW meeting tomorrow night and the county board meeting on Thursday night, and be able to kind of just give a statement as far as our beliefs of why we should be able to enforce and why it's important for us to be responsible in enforcing these mitigation measures and any others that may come eventually or be happening, so that there is enforcement of this and so that we can protect lives. So if there's anything at the end of this discussion or throughout this discussion that you want me to take with me, I can certainly do that. Just to give you some information, as you all probably remember, because we've talked about this a lot of times, if you take yourselves back to November 23rd, we did put some information out actually as early as November 16th via a press conference that we had with our city and county partners, and also several healthcare providers in the system whom have been partnering with us throughout this time. During that press conference, on November 16th, we did talk about the positivity rate, what was going on with the hospitals, and we did have the hospitals and the local FQHC on the press conference that day, and basically urged the community to please take every precaution that they possibly could. That was also around the time that we had put out the ask to schools, faith-based organizations, and bars and restaurants to please do everything that they could to follow any type of precaution to keep people safe. If you fast forward to November 20th, that is when the Tier 3 mitigation measures were put in place. On November 23rd, I did a review of all of the data here in Macon County and reviewed it from October 23rd to November 23rd. And in just that month, we had seen an increase of 3,189 cases. So we had more cases in 1 month at that time than we had during the previous 7 months of the entire pandemic. Also at that time, we had increased 58 deaths or losses of precious Macon County residents, and that was more deaths in 1 month than we had seen in the 7 months combined throughout the entire pandemic. Our case rate was 675 per 100,000, and the target was 50. We had 57 hospitalizations, and we're at a 16% positivity rate. The numbers at that time were out of control, and no matter what we did as a healthcare system, how hard we worked, or as many healthcare providers and professionals that we had in our community, it started feeling like it wasn't enough to take care of what was going on. We were about to go into additional mitigations as a region at that time because our numbers were heading in that direction. And then, of course, as you know, the governor's office and IDPH did put the entire state into mitigation starting on November 20th. I'm going to share my screen with you and show you some of the trends that occurred after the implementation of the mitigation measures. Give me just 1 second. Can you see the statistics there, or do you see the charts?
I see just a little a little circle and a mouth.
Well, that's not what you're supposed to see. Hold on one second. Bear with me. I apologize here. While I'm looking this up, just so that I can show you this visual, which I think is important, what I can tell you is what we've already discussed as a board, which is that these mitigation measures appear to have worked. There was a significant decrease in our positivity rate very soon after the implementation of these mitigation measures. And there are other healthcare workers and other healthcare professionals and community leaders that do agree that these mitigation measures are most likely one of the greatest explanations for why we were able to see some of that drop. And what I'll do while I'm bringing this up actually is I did speak, and I have been speaking with throughout this time, Tanya Andrix, who is the CEO at Crossing Healthcare, and she's been a partner of ours throughout this time. And she was willing to speak to this and her thoughts that do correlate with what we feel here at the health department as far as the importance of mitigation measures. So Tanya, if you wanted to speak on your thoughts, then I will mute myself and give you some time to speak.
Thank you, Brandy. Yes. Thank you for giving me this opportunity to speak before the Board of Health. Since March, when the pandemic began, Crossing Healthcare as the federally qualified health center has worked in lockstep with the local health department, Brandy and her team, to be as supportive as we could of the efforts of the local health department and also ensure that Crossing is reaching the underserved populations of our community to make sure that the effects of this pandemic did not continue to have a disproportionate impact on our very vulnerable populations. In the beginning of the pandemic, we did see that, and we worked as a community very hard to try to offset that disproportionate impact. As a result of those efforts, we have seen that the impact across the county has levelized and is no longer disproportionately impacting our population. We pay very close attention to this data because, it is very much important to us and our federal funding. At the same time, as we watch this data, we're also able to see the direct impact of mitigation efforts on what we see in our positivity rate. And it's undeniable that when we saw the mitigations happen, we did see a decline in positivity rate and disease. We saw a decline in hospitalizations. And I will tell you that none of us want to go back to those difficult months when our hospitals were incredibly busy and struggling. There were several weeks there where it was definitely a struggle. And so I think that this is important for the Board of Public Health to understand that all along the local health department has been following guidance from IDPH. We have worked alongside and watched all of that happen, have listened in to the same, information webinars and guidance from the state. We've listened alongside the local health department, so I can, certainly attest that Brandy and her team listen and understand their role and the expectations the same way that I would understand what she is hearing. And again, I just think it's important for the Board of Health to understand that, her team is taking a very rational and reasonable approach to their decisions and to the things that they're doing. And I watch that happen. And, as difficult as it has been throughout this pandemic, to see the impact of the pandemic on business, on bars and restaurants, on people, and on loss of lives, I think it's important that we not forget that, this has had adverse impacts across, our entire country, not just in our local region. And so as hard as it is to watch our bars and restaurants struggle, we can't lose sight of the bigger picture. And we need to stay the course here, in my opinion. And, we are now working diligently with Brandy and her team to get vaccines disseminated across our community. And that is the solution. And that is the path we need to take out of this pandemic. And I want us to stay focused on that and our efforts focused on those things, recognizing that, no one wants to have mitigations in place, but if we can move towards vaccines and vaccination, that will be less necessary. But I think it would be important to lose sight of the importance of mitigations if those positivity rates were to increase. Brandy, is there anything else that I should mention?
I think that's it. I appreciate you being on, and Tanya has definitely, been a very valuable partner in all of this, always stepping up to assist us in any way. So I'm very grateful that she also has been able to speak to the data and the fact that some of these measures have worked. So thank you so much, Tanya. And I did get my screen share to work, hopefully. So now I will be able to show you. Okay, so there's just a few things that I wanted to show you just so you can see a visual. I know that I'm a very visual person and this helps me. So this is actually Macon County specific data. This is not what is used for the mitigation measures or for moving from one tier to another. This county information is used more specifically for decision making and just being informed, and then also, as you can see, for schools. If we scroll down here, this is the case rate per 100, and you can see the time period where we got our highest here, right around there. And then, of course, the mitigation measures were put into place November 20th. You can see a very significant drop. And then as you can see now, we are seeing a little bit of an uptick again. Hopefully that is not the beginning of a surge from holidays, but of course that is something that was predicted if people did choose to gather. So we were expecting the possibility of that happening. And as you can see, there is some of this happening. And these numbers are through January 2nd. So there has even been somewhat of an increase since then. So you can see here as well, and going over this 8% threshold, and you can see the highest we got there on that November 14th. And then again, it drops, and now we're seeing a little bit of an uptick there. And then deaths, as I had mentioned, of course, that's a lagging indicator from when there are cases. I know there were days when, many days in a row, that we had a death, at least one death, and sometimes many more per day that we were having to report to the public. And so you can see, of course, the drop with that, and a little bit of an uptick is there as well. Now, with this information, you can see that this is specific to hospitals. And so they do report data in as well, and you can see the decrease there. And that's emergency department visits. And then, of course, COVID-like illness admissions. Oops, sorry. And you can see those decline as well. One thing that I will say, and I'll move us all over to our regional data, which is what they use to determine those mitigation measures and where we would be as far as tier 2, tier 3, et cetera. These numbers you can see are a little bit more recent than the ones that I just showed you. And so you can see we are in the green for a couple of these. And now as a region, we are back in the red for a couple of those. And these are the pieces of information that they use to determine if we are going to be moved to mitigations and which tier we will be moved to. So I will show you before getting into Macon County specifically, this is region 6 without those U of I tests. And so that is what they use, and that's at 9.4. And then I'm going to bring you to Macon County because, of course, as we make Macon County decisions, those impact us most directly, but then, of course, do impact our neighboring counties and the rest of our region as well. So you can see Macon County, the numbers were low. They got to the point where they were much lower, and then now we're starting to see that uptick that I did mention.
Copy of that, Brandon?
What's that?
A copy of all your.
Oh yeah, yep. It's the stuff online. I could get it to you. Mm-hmm. Okay, so getting back into the discussion. Well, I guess I should stop. As far as with the data, does anyone have any questions about the data piece at this point? Did you want to do any public comment or anything? We had that at the beginning, so I didn't know.
You did? Oh, I'm sorry, I got caught by
That's
a train
okay.
and I was late.
It's okay. Do you want to?
Yeah, sure, I'd love to.
Okay, so what I'll do is I'm going to mute mine, and then I'm going to turn this on for you, and you'll come speak somewhat near this computer because that's where it's going to pick you up on the microphone. Yeah, so give me just a minute. Kevin's going to do some public comment, so give me just one moment.
It is now. Just now started. Oh,
Speak now, Kevin, see if they can hear you.
Can you hear me now?
I'm gonna turn this one off so they'll hear you from behind the
Okay.
technology.
No.
Just make sure you speak up so we can
So I
hear
need
you.
to start over then, or?
Yes, probably start over if you can so they can hear you. Just make sure you speak up.
All right. Hello, everyone. Appreciate you letting me come in and have the opportunity to talk to you for a little bit. I want to make it clear that this is not the county board against the Macon County Health Department. And we've been pretty supportive of the health department. I feel like I've been supportive of the health department. I think you do a great job. I'm not sure that the people are getting through to the health department. These bars and restaurants, theaters are in a tremendous financial devastation. And, you know, I understand that there's a possibility of an uptick on this. You know, we watched Thanksgiving, we watched Christmas. The thing is, these people are going to go bankrupt. Now, I realize there's people's lives at stake here and you know, but these people's lives are at stake as well. And the state's attorney has flat said he's not going to prosecute, you know, whatever to anyone that's open and trying to do the right thing. So I don't want to have to change the health department's rules. But on the other hand, we got to do something to help these people. The county doesn't have enough money to offset what they're losing. I know the city's going to try with some of their CARES money. You know, I'd asked Brandy about maybe if the health department had somewhere they could offset some of their losses. If we tell a person they got to shut their business down, we should be ready to compensate them for it. And, you know, these people have got everything, their heart, their soul, their whole investment, their whole life in some of these businesses, and we're going to bankrupt them at no fault of their own. And I just, I know it's hard for all of us, but, you know, I've owned a restaurant. It's hard to make a living in a restaurant on a good day, let alone a bad day. So we got to do everything we can to try to help them. If the state's attorney's not going to prosecute them, what's the point of going outside them? So, you know, a lot of them are open anyway. You go to any of these small towns, they're all open. You know, I know there's, Brady's got documentation that shows that when we shut down the bars and restaurants, our numbers went down. I'm sure they did some. I don't know whether they went down quite as much as, you know, whether that was the whole reason why everything went down. My guess is probably not. I mean, during Christmas time, if you drove around, you looked at Lowe's, Menards, Rural King, I mean, hell, every one of them, the parking lots were packed. And when you got a poor guy there that's closed because you shut him down, you know, it's just not fair. So, you know, I don't know how much money Brandy has in the fund. Maybe, I know he's going to check. But we either got to compensate them or help them get back open. And if like I said, if the state attorney's not going to prosecute them, I mean, why not just look the other way and, you know, if things get worse, which there's probably they will some, but you can't shut a whole economy down just because of the pandemic. We got to find a different way to try to do this. And, you know, I don't have the answer, but I know taking a man's spirit and crushing it and bankrupting him isn't the answer. So, there's a couple county ordinances that state's attorney feels like if we change that it would put some dampers on the health department. I don't want to have to do that. I think they're tools that maybe not here, but other places you're going to need them. But we got to do something, folks. These people are hurting really bad and they're going broke, and they're going to open up anyway. And I don't want to see them penalized for, trying to save the business. We're on a phone call every other day with all the hospitals and everything. It's easy for us to sit back and none of us will miss a paycheck. But you tell that to the guy that's trying to make a mortgage payment and a house payment and a car payment and you got kids in school, you know what, which is worse for him, COVID or going that or that? My guess is he can't tell the difference. So, I appreciate your time. I appreciate what you do. And I'm not against you. I'm not against the health department board. I'm not at all. It's a tough time and it's a tough decision to make, but I think this is something that we're going to have to try to find another way to work through this pandemic without shutting down your local economy. So that's all I got. Thank you for your time.
Thanks, Kevin. Okay. And we still haven't had anybody else show up, just so you all know. So there's no other public here to make comment. And so we'll just jump right back into some of the information. And I do want to address some of the points that Kevin has brought up as far as kind of on the, I don't want to say other side, because we're all in this together. A pandemic is a terrible experience for everyone. This is not an us against them. There are certainly not any winners in a pandemic, not the health department, not the healthcare workers, not the establishments. And so I don't want to propose it in that way, but I do want to address some of the items that he did bring up when he was speaking. As far as turning or looking the other way, I know that's something that has been brought up. And as a public health professional, not only in my career that I've been here, now going on 16 years, and when I became administrator, I made a promise to myself and to all of you that were there during that time that I would remain ethical and moral. I do not feel as if the health department looking the other way when businesses are violating the orders that have been brought down by the governor's office and by IDPH that are based on guidance received from doctors, scientists, and epidemiologists is the responsible or ethical thing to do. I understand right now it might be the easier thing to do and maybe more people would like me and like the health department, but if it means saving lives, that's what my job is. That is what my passion and my career is dedicated to, and I can speak on behalf of my team and say the same. We're not here to be heavy-handed or try to close as many businesses as we can. We are not the ones closing the businesses. The state has issued mitigation measures that should be followed to try to mitigate illness and, quite frankly, save the lives of our residents who we are so concerned about when it comes to their freedoms and their rights and their businesses. And it's not just the owners of these businesses that are suffering, it is the employees that work there as well. Not only when it comes to their paycheck, but if they come to work and they get sick, or if they're one of the many, many employees who call us and are terrified to lose their job because employers are forcing them to come and be in unsafe situations, those are all things that are happening too. So I am definitely empathetic to what everyone is going through right now, specifically the food establishment and other business owners that are losing what they have and what they have invested their life's money and their life's work and their family time into. I totally understand. But I do want to make it really clear that it's not the health department being against these businesses. Just like before COVID-19, we do everything during COVID compliance and enforcement and follow-up and just consultation to support these businesses, whether it's food establishments, churches, schools, or just a retail business. Our team have gone out and done tours of buildings. They have done infection control reviews. They have looked over plans over and over, edit after edit, and worked countless amount of hours to try to work with businesses to support them to be open in the fullest capacity possible while also keeping their employees and our residents as safe as possible and protecting their lives. When we do receive complaints, as we've talked to you as a board about several times, we do go through a several step process. We go through education, friendly calls, like I said, walkthroughs. It takes several steps before a cease and desist order is even issued. As a reminder, at the step of a cease and desist order, that is just us telling them to stop violating whichever part of the order that they are violating and to please get compliant. Then we only go out again if we receive another complaint in order to suspend that food permit. If you remember, we weren't even suspending food permits until later in the year. So we've been doing this complaint and education process for months, since March. We've been taking these calls and following up on them and doing our due diligence. And we have promised you and the community that that's what we would do. And I don't expect to just stop doing that right now. I think it's important as the public health department to prioritize public health, to lead by example, and to ensure that we are protecting lives. So I understand right now that health and economy are suffering at the same time, but it is our job to prioritize public health and to advocate for that. We only ended up suspending one food permit, as you all are aware of, as we keep you updated at all Board of Health meetings, which was the Texas Roadhouse establishment. Other than that, we have not had to get to the closure step of any other establishments, because once we were out and the city as our partner was out enforcing this, many places that were not compliant chose to start being compliant. Now I have heard, and I think Kevin was referring to this possibly, that there are restaurants that are considering getting together and just all opening up at the same time so that we can't quite possibly enforce that or deal with, possibly hundreds of food establishments all opening up at the same time. If they do that, maybe that is true that we can't get out to every single one. But what I can tell you is at least at that point, it wasn't us deciding to look the other way during a pandemic. And it wasn't the county choosing to take away our ability to enforce measures that have possibly saved lives and could be used to save many lives again in the future. We have to remember that, yes, right now we might be seeing a slight uptick, but what if we get back to that situation that we were in November? We go back there where literally the healthcare systems, the CEOs of the hospitals and FQHCs and myself were begging the community to take measures and sacrifice time with their family and take a lot of other measures to protect lives and to protect our hospitals and to make sure that people weren't on a cart in a hallway in a hospital because there were no other choices. If we get there again and the county board has decided to take away our ability to enforce COVID-19 regulations specific to indoor dining, who will do it? The only other entity at this time that has been willing and able has been the city of Decatur, and we are extremely grateful for their partnership and that they have allowed for their law enforcement to go out and even look into coming with us in an off-duty capacity to be able to give us a preserve the peace role with our staff when we do go out. If the city decides tonight at their meeting that they will not continue enforcement or that they will back off of that, and we are robbed of the ability to be able to do that, if we get into another surge, who will enforce that? Who will be able to actually do something? If you have a state's attorney like Kevin mentioned, who does say and outwardly says that he will not prosecute these things, who will be doing anything in Macon County to help ensure that these mitigation measures are being followed? It is true that we were told that the state's attorney's office previously, and then with, the new state's attorney, would not prosecute these things, even if we did suspend a food permit. You all, were updated throughout the process that we had consulted with legal on an ongoing basis throughout this entire time. So I know the question has also come up of whether or not we overstepped or did something that was outside of what we should have been doing. And I have been told by legal we were absolutely well within our rights to do what we have done. And we wouldn't have done that without getting legal consultation first. And we did that, as you all know, on our Board of Health with our legal liaison with the state's attorney's office, Michael Baggett. And so one of the things that I heard when we were talking through before I talked it through with you as a board about do we take this step when we decided to go ahead and start suspending food permits if and when appropriate. was just because someone else won't do step 2 doesn't mean you shouldn't do step 1 as part of your due diligence and knowing you're doing the right thing. So yes, we did know there was a chance. And of course, we weren't going to broadcast that the state's attorney's office wouldn't back us up on some of those things, but that didn't mean that we were going to look the other way and not do our job, so that we could lay our heads on the pillow at night and look our families and our communities in the eye and say we did everything that we could to keep people safe. Whether or not you know somebody who has passed away, and even if they haven't passed away, who maybe have these negative implications still after having COVID possibly months ago, and they don't know what that's going to look like moving forward. Whether it's someone you know or not, those people are important. They do count. And I also want to address the question that seems to come up rather frequently, which is, why can people go to Lowe's or Menards, et cetera, and they can't go have a meal? The difference between those two things is that generally when you're inside of a type of retail store, you're not having that longer interaction with someone that would put you at greater risk of ending up getting something from someone. So if someone had COVID-19 and you passed by them at Walmart, most likely you would not get sick from them. If you're not having that sustained contact within 6 feet for 15 minutes cumulatively, your risk is going to be less. However, if you enjoy a meal with someone out at a restaurant, there's a good chance that if one of them was sick and maybe they were asymptomatic or pre-symptomatic and they were having a meal with you and took their mask off and you were with them for a sustained period of time, that you would be subject to the risk of getting infection from that person. They're two totally different interactions between people. So I wanted to provide clarification for that. And then also, as far as surrounding communities, it is true that some surrounding communities also don't have some of the support from their partners, whether that's law enforcement or government officials, to be able to enforce some of this. And some of them, frankly, don't have enough staff. Thankfully, we have an extremely strong environmental health staff that has been able to follow up on these things. We have been able to hire additional staff to support us in our contact tracing. And the Champaign-Urbana Public Health Department is a prime example of a community that has been very strict on these things. Their numbers are reflective of that, and they do have a state's attorney who has aggressively partnered with them to ensure that they are backed up as a health department. One of the other things I want to remind you of, if you haven't heard it, is that the governor's office did say when they put in these mitigation measures that they were looking at an incubation period following the most commonly or traditionally celebrated holidays, which would put us, and now they've verified this, at January 15th. We are very close to January 15th. And now we are even looking at the fact that Macon County is the region is possibly in the red in some of the warning levels, to where we may not be able to move out of tier 3, or if we move, we might only move into tier 2. So the other thing that I ask you to just consider and think about is, if this ability for us to enforce is taken away and the city chooses not to enforce, things could get a lot worse, and there may be no one that is able or willing to do any kind of enforcement in our community with this. So I think that I've covered most of the points that I have. I know Board of Health, some of this is probably redundant to you because we talk about it every month, but I just wanted to be as thorough as possible so that everyone felt like they had the most recent information. And I'm certainly open to any discussion or questions that any of you have at this time. I think that it's also important to note, and nothing that our board is going to do today will change this, but I know that I've said it to Kevin, but I just do want to bring across the point that if in a situation like this, where yes, as a community we have been partnering, and I hope that we can continue to do that, if when things are so close with a vaccine, when we can see the light at the end of the tunnel, we've worked so hard as a team here at the health department and as a community to get through this, and we have lost people. I don't feel like now is the time to take away a responsibility of the health department that could eventually affect our funding as a health department at the state level. There has also been talks or threat of businesses whom have taken state or federal funding losing that or having to pay it back if they violate these orders. And I just don't think that right now the best move is for the county to, I know that you're not saying it's against, but to appear to go against the health department by taking our ability to enforce something that we are responsible to enforce to be able to save lives. I also think that that sets a precedent in moving forward as a community and as a health department with our relationship with the county board, which has been, you know, a primarily positive relationship, and I want it to continue that way. But with something so serious, it does give me concern that, one, it could impact us as a health department if the state does take any of our funding, or if they start speaking about our certification because we are not upholding our responsibilities specific to some of these orders. And then also just how that appears to our community if our county board kind of goes against the health department and the guidance that we provide and that we have followed from doctors, scientists, and epidemiologists. Any questions or any discussion at this point from anyone?
Thank you, Brandy. I'll see if anybody else from the board has anything to weigh in on before I make some comments.
Brandy, this is Kathy. May I speak?
Yes, of course.
Hi, guys. This is Kathy. And you know, as Brandy said, I'm going on my 17th year with the board, or with the health department. And from day one, I was always under the impression that part of the Board of Health's power was to help and promote the suppression of disease. And right now, I feel like we're losing that power. And that does scare me. What's to happen the next time we go close a facility regarding roaches, let's say? Are they going to go to the county board, and now the county board's going to open up our ordinance again to state that we have to have 52 roaches or whatever the case may be? It is very concerning to me that I feel like we're losing our power. And definitely, as Brandy has said, that when it comes to a pandemic, this is not the time to test those waters. Thank you.
I guess I just have a couple questions real quick. This is Phil. As far as like the contact tracing and everything like that we've been doing for a while now, I believe. I mean, is there anything that is relating things back to when these restaurants and bars were open as far as those statistics go?
Yes, there has been. You can actually, and I don't have it popped up, but you can actually look on IDPH's website and find they have a graph that shows where cases are most commonly exposed based on contact tracing. And that is pulled from the Salesforce program, if you remember, that I had told you about, that was implemented during the summer for contact tracing, whereas we used to have kind of the older version of doing things through INEDs and then on paper. Even before we had Salesforce, and people were asking us where were the cases being linked to, one of the places that we listed among several others when I was asked by the community, by the public, and at press conference, was people going and gathering at bars or restaurants. And that was even very early on, that we were able to see that even when we had a smaller team working on this and when there weren't as many cases necessarily as there are now. One of the things that we saw when that was happening was not always with staff, although sometimes it was with staff, but it would be, you know, friends or family members meeting up at the restaurant and thinking everybody was fine, and there ended up being someone asymptomatic at the table, and everybody at the table ends up sick. And then you've got, you know, let's say there are 5 friends dining out that all take it to their homes, and then they give it to everyone in their home before they even have a symptom, if they end up having a symptom. So it's something that can domino very quickly, just like any gathering that we talk about right now with people outside of your household. And that's something that we were seeing even from early on. But they do have that graph, Phil, that shows by percentage where cases are most commonly exposed.
All right. And then also, so next week then we've got schools opening back up, a large majority of them, correct? Are they still doing food service at the schools?
To my knowledge, all of them have been doing food service, and then the ones that have been closed have set up some kind of arrangements for delivery or pickup so that the children could still have food.
That's correct. So those that have been doing remote learning, such as, let's say, Decatur Public Schools, they are getting all of their food prepackaged and being sent out. When they open up schools, of course, then we're going to have to worry about, the kids and the teachers all eating in an open cafeteria, and potentially spreading it that way also.
But I'm assuming they're going to put mitigation factors into place in the schools during these. They're not going to have them all crammed in a cafeteria. They're going to have them spread out.
Yes, there are some mitigations already with ISBE. And I know a lot of schools, they're trying to lessen the amount that the kids move through the school. So they may be having lunch, let's say, in their classroom, instead of passing through the hallways and going, to that main cafeteria to eat. So they are trying to work on that. And ISBE does have some mitigation on that.
And then Phil, I actually brought that graph up so I can try to show that to you real quick and where you would be able to find it. Oh, maybe. Hold on, sorry, it's being kind of weird for me today. Give me just a minute, I'll bring it back up. What I did
fine. I
basically,
can get that from you later too.
okay, I basically just Googled IDPH case risk exposure and it came right up. So I'm not sure why my sharing is being strange today, but if you just Google that, it'll come up for you, Phil. And then it does provide for statewide or region specific, and we're region 6.
Okay. And real quick too, I've got to go pick up my son, but
Okay.
Just real quick, I just want to say that, no matter what the health department does, as a member of the board, I'm going to back that 100%. Okay. But I just also want to state that if, the county board set on changing this stuff, I would really encourage that it be at least the second one that would still provide us with some sort of, or provide the health department with some sort of enforcement. And that is the ordinance that has the mitigation or the limitation on the number of people that would be allowed and the spacing inside. So if they're going to pass this regardless, I would encourage them to do the second one, or B, on the ordinance if they do go forward on that. That's my opinion. Thanks.
I would agree with Phil. Go ahead. I'm sorry.
Oh, you can go ahead, Mary Jane.
I would agree with Phil about that. And I will say that I say this to students all the time. I'm a nurse, that, people have grandiose ideas, and I'm not taking away from the fact that people are hurting financially. That's horrible. And I cannot imagine. But the bottom line is, if you lose your health or you die, it doesn't matter, what went on before that or whatever. And I know that, that's not much consolation for people who are hurting. And like I said, my heart goes out to them. But I think the bottom line is, when we know that there's something that may be raising the rates of positivity, and we know from graphing this that this may help, we know that there is a vaccine on the horizon. It's already started. That I think that, if we could out a little more time and see, rather than going back to the way we were, I think that it's the Board of Health's duty really to see that, if you have your health, you have everything philosophy, because lose your health no matter what you have, you can't enjoy it, or you may lose your life. And I get so aggravated when I go places and these people are walking in and out without masks. If there's some way to really strictly enforce all those rules, but obviously that's not even possible for one small group of people to do that. But there are so many people, I think, that don't take it seriously enough. I'm not talking about business owners, I'm talking about the public. And it's hard to go around and when you have however many thousand people in Decatur and go around and, you know, have a certain group of people you're going to police, so to speak, it's not even possible. So all of those things is why I think we should hold on longer.
Well, and one thing, just to provide some clarification and thought as far as the sustainability of a change like this to our ordinance is, even some of the places we have issued cease and desist orders for, I know one, for example, was indoor dining, but also their staff were walking around without masks, their chef was cooking without mask. And so in that situation, depending on how this ordinance looks, we could potentially still suspend a food permit even if they are indoor dining, but they're violating these other things. And so then I wonder, is that going to come into question, and or is that going to be enforced or followed up on by the state's attorney? I don't know. We can certainly beg the restaurants and the staff to do that, or any of the stores to do that, quite frankly. But obviously only some places we have the jurisdiction over that we have used to suspend food permits. And Paige, one thing I did want to say, and I don't mean to rush anything whatsoever, I know that we had talked about there's probably not a vote to be had for tonight, but if there was some type of vote that the board wanted to bring forth, right now with Phil, we have 6. So if Phil leaves, we will only have 5, but that's only if the board was wanting to vote on something. So I just wanted to make you aware of that, Paige, just so you knew where we were at quorum wise.
Thanks. I personally, I don't know with the trajectory that this is on. I think that you giving input is probably sufficient in having the input from here. But if anybody on the board feels strongly that we should vote on something today, please let me know.
This is Vivian. I don't know that we need to vote, but I do want to assure Brandy that I am behind you 100%. And I think, you know, as board members, we should at least voice our support, whatever that may be. As far as, you know, as Phil said about the restaurants, I think if they have to make changes, I'm also agreeing that all the power should not be taken away from the health department. There has to be some kind of rules, some kind of guidelines. There has to be something. That's what we're here for. So I would be the second one. If it has to be done, that would definitely be the one that I would want to go with, because if you're taking away everything that the health department is doing as far as enforcing these guidelines, you're basically giving these establishments a license to kill, so to speak. Yeah. That's just my opinion. So, you know, you have to ask yourself, how many lives are you willing to risk to make whatever money you're going to make? But I'm sorry, that's just my opinion. You know, I am on the Board of Health because I care about this community. I care about people's lives, and you guys have been doing a great job, and I want it to continue. So I am 100% behind you.
Me as well.
Thank you.
And Brandy, let me add too that, you know, it said that these weren't necessarily a final addition here. So, I mean, if the county board does choose to amend that, I mean, is that going to be done on Thursday, or is there going to be time in there for meetings and discussion and adding language there about what restaurant staffs and cooks are going to be required to do for mitigating circumstances and things of that nature?
Well, I know that they will, and of course Kevin's here, so if you want to add something, but they will discuss tomorrow night during EEHW. So from what I was told, I would think that edits could be made at that time. And then I think there can be amendments when they vote on it Thursday night, but from what I've been told, they plan to have this voted through this week. Unless I think we just agree to look the other way, right?
The 2 issues?
No, like the choice was we look the other way, or this was going to be voted on this week.
That's
Right.
a possibility. I mean,
Does that answer your question, Phil?
Yeah, well, yes and no. I mean, it answered my question a little bit, but then, I mean, so going in there and just completely opposing this, and then nothing
maybe some-
happens tomorrow night but the change of the wording, and then Thursday it gets passed as is, we don't get the opportunity to even be involved in that then. So that was my only concern.
Oh, you mean as the Board of Health?
Yeah.
No. I mean, unless you involved yourself in some capacity. And obviously, we were able to have a meeting through the emergency meeting, through Open Meetings Act, just so that we could discuss. But basically, at this point, it's out of the board's hands as far as being able to do anything other than just provide some feedback. Of course, one of the things when Kathy and I met with them that we did say was, if they're going to make this choice, that we still would really encourage businesses to follow all of these types of recommendations to keep things as safe as possible. We did provide that information to the city as well, and we said and made it very clear, we do not approve going against the Restore Illinois plan because those are the recommendations that should be being followed. However, if people or businesses are going to violate here in Macon County or look the other way, can you at least please do these things? So if you did have someone that ended up sick, we would have phone numbers or we would know who ate there. You know, if you have a server that served people at a table, you know, if you do some, you know, gathering of phone numbers and names at the door, then maybe it would make contact tracing a little easier to help control some of that spread. So we would still, like we have throughout this, when there have been businesses that were non-compliant, we follow our steps, but we continue to provide the guidance that if they are not going to make the choice that we feel like is the safest and right choice, that they would make a choice with some public health perspective and prioritization in there.
Thank you.
Yeah, thank you, Brandy, and thank you everybody for all of your input. And I'll give if everybody else has something to say as well. You know, I struggle. You know, I'm an attorney. I'm a rule follower, and whether or not I agree with everything that's being done, I still feel like it's our job to uphold the. I'm sorry, my puppy's sitting next to me and is gonna chime in too here. I struggle with taking away our ability to enforce what we're here to enforce. You know, looking at the states around us, whether or not I agree with the fact that we have to close indoor dining. I haven't done much research, but having family and friends in other states far away and closer that still have the ability to indoor dine and all of that, and their numbers are similar to or not much or better than ours. I struggle with all of that, but at the end of the day, our governor has put us on this plan, and I think it's our duty to enforce it. And I taking away that ability for a time when it could get much worse really concerns me, especially when I hope that we're on the path to opening back up sometime in the near future. But at the end of the day, Brandy, I know this board is behind you and I support what you need to say to the county, and you know, we'll handle it when it comes down, how it comes down. So thank you for all of your work, and Kathy, thank you for your work too.
Thanks, Paige.
Thank you, Paige.
I also do like the second option of language better, if that if that means anything. I just think it gives us a little bit more to hold on to in case there is something that pops up. Does anybody else have anything that they would like to add? Or Brandy, do you have anything else to add?
That is all I have right now. Like I said, I will be presenting, and Kathy is going to as well, tonight at the city council meeting, and then tomorrow at EEHW, and Thursday at the county board meeting with some of the same information, and, you know, doing everything that we can to advocate for these public health measures to be followed. That's all I have, though.
Thank you. I don't, do we need a motion to adjourn at this point?
Yeah, motion and then a roll call vote.
Oh, yep, okay. Do I have a motion to adjourn?
I so moved.
Do I have a second?
Phil seconds.
Okay, can we get a roll call vote, please?
Paige Toth,
Yes.
Candace Clevenger,
Yes.
Vivian Goodman,
Yes.
Sue Kraus, sorry.
Yes.
Mary Jane Linton,
Yes.
and Phil Tips.
Yes.
Well, thank you so much, Brandy, for everything you're doing. And
Thank you to
have a great
everybody.
day.
All
Yes.
right, take care.
Thank you. Thank you.
They're just adjourned.
Mhm.